Micah?
I would love to start. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, can we get a roll call? Can you handle that too? I'm adding to your duties already.
Freeman,
Present.
Berkowitz, Costa,
Here.
Dean Schlappman, Hickey, Mitchell, Butler,
Here.
Williams.
Here.
We have a quorum.
Okay, thank you. Can I get a motion to approve minutes for November 6th?
Motion Freeman. Second.
I guess we get a roll call for that.
Freeman,
Yes.
Costa, Butler,
Yes.
Williams. Motion passes.
Awesome. Okay, do we have any public comment? Anyone from the audience for public comment? I was actually trying to figure out one other way to say this without repeating myself exactly. Is there any comment from the public?
Yeah.
All right, thank you. Any old business? I do gently want to just remind everyone about old business here. I want an old business to have animal control on there until, I'm gonna just say it, I just want them on there until I get some sort of, I want an intergovernmental agreement between animal control and the municipality of Crete and Moni, just as they just gave one to Frankfurt. And I remember when I brought Frankfurt in, they weren't gonna get it, but they got it. And it seems to me, if we have an outside source that are taking these animals, that we should be able to do this with these other two municipalities. I mean, the people that are coming in here, they love these animals. They do everything they can to try to find them a home before they call animal control. These animals are sitting in the backs of these police stations in supply closets, okay? We have an outside source, whatever it costs, the municipalities are willing to pay for it. So I want it to stay on old business until we get that resolved. Yes.
Just a note, it should probably, instead of saying animal control, say animal protective services.
I am sorry, I stand corrected.
It's hard because like Joliet is animal control. I get it. But if when it is added, it should say animal protective. Thanks. That's all.
So you want that,
In old business, I just want it listed until, because in one other item that I've been repeatedly asking for is I want the agreement between animal control or the county
Mhm.
and the agency that is taking these animals. You know, none of these municipalities that are coming to me are asking for this for free. They said, we'll pay for it. And I'm telling you, these officers love these animals. They do everything they can to find them a home.
so you want animal protective services on as a discussion item, under
Old
old
business
business
is to show up every time.
then? Okay,
And those are the topics that I'm gonna be discussing every time until I get
All
it
right.
resolved.
we can do that. And what other piece of information you were looking for? Is it, IGAs from,
I want IGAs for Crete and Moni
but you
municipalities.
just asked for something else.
And
as
then I
well.
want the agreement between, I can't even tell you who, the outside source that is receiving the animals.
Okay. All right, I'll work on that.
You know, I was originally told that there was 9 IGAs, but I researched it and it looked like there were 18. So now I'm, perplexed here. And if we have an unlimited source to get these animals, every municipality should have access to it. And as I said before, their first choice is not to give them to the county. Their first choice is to find a home for them. Okay. Thank you. And on to new business, who we have, Robert Hoyer, who's, very active in the food business
Morning, Bob.
or getting
Morning,
food.
Thank you, Chair Butler. Go right here.
You are good to go.
All right, thank you. Yeah, my name's Bob Hoyer, H&A Networks Consulting out of Evanston. We do community government media relations work to support organizations trying to increase the supply of healthy food, among other things. And I wanted to come today to talk about a project we're getting off the ground with the Will County Center for Economic Development called Bringing Good Food for All to Will County and Beyond. There's a policy component, finance, and communications. And the purpose of what I want to talk about today is we're in the process of seeking some grant funds and probably be wanting to come back soon with seeking letter support, that kind of thing. But first of all, so the policy piece is the National Association of County Good Food for All policy that Chair Butler successfully advocated for in 2024. And the idea was the lesson out of COVID was when empty grocery shelves during the pandemic underlined the need for well-resourced regional scale food supply networks. And it's really on counties in the case of an emergency and just, you know, what we continue to see that there's kind of an emergency food planning function that needs to be taken on by someone, especially now that there's this breakdown in the federal resource delivery system. So how the emphasis of the policy was about lessening our reliance on federal funding so that communities can figure out how to feed themselves and work more collaboratively with all levels of government. So that's the first piece. And then in terms of the project, what we want to do is initially do an asset mapping in a tri-county area that Will County would be the center of, to get a handle on who's producing what in terms of food production, processing, distribution, marketing, food waste recovery, moving with the idea towards what are the funding needs for all those kind of constituencies, not just in a particular year, but over a period of 5, over a period of 10 years. So we can start thinking more strategically in that way through locally driven collaboration. The second component would be to develop a food system financing project. And I've been working with Illinois House Agriculture Committee Chair Sonia Harper, who's from the south side of Chicago and Englewood. We've been reaching out to develop really looking to, like, by a year from now, we'd like to be going to the General Assembly with a plan for a good food funding that would bring together all the financial sector players. It's the farm credit system is very interested. They really want someone's help to pull together community banks, philanthropy, impact investors, and then in turn to be able to go to entities such as the state, the Treasurer's Office, the Illinois Finance Authority. What role can they play? But again, driven from a community need basis coming out of the county. Coming out of the counties such as Will. And then the third final component is, and it's really what I want to draw your attention to today, is communication. So we need to be telling the story about the innovators working from the grassroots. And so I had yesterday, Jackie Rogers, I had her send around an article that I wrote. I don't know if it's been received yet, but it was an article. We want to be generating content on an ongoing basis for Local Food Forum. And this first article takes a look at the Riverwalk Food Pantry right nearby here and the challenges that they're facing, both in terms of their traditional supply chains from donations from groceries as well as from the regional food bank. But what can be done in terms of more local sourcing? How you were talking about municipalities. How can municipalities be more engaged in allowing people to be growing more food, backyard chickens, that kind of thing? The conversations I've been having with the Center for Economic Development, a couple months ago, that brought forward a client that's interested in developing like a local food business, and the CED was surprised to discover a half dozen different municipalities immediately reached out. Hey, how can we get involved? So there needs to be a much better dialogue. And as you see this article, I'd be happy to answer questions about it. But, there's going to be a massive federal cutback in SNAP benefits, it's going to put more pressure on the food banks. And again, it's ultimately, it's the counties, it's the municipalities, it's the townships, it's the school districts. How can we all be working together? And so I encourage you to take a look at that story, and happy to answer any questions you have, or just circle back next month and keep you guys updated. Because I think another part of this is just to be bringing information forward through a public platform like this. And then also the MAP Collaborative run through the Health Department is a very effective convening entity. And I envision, like, every month there's like a really good information being shared, and we just really need to gin up a conversation about how communities solve our own problems when it comes to food and farming. So any questions or?
I love the thought. You and I have talked on a hay ride one day. I know that, are you talking like gardens? Are you talking about, like, I know some townships, some municipalities have public gardens. Is this what you're referring to? Or are you talking more large scale, like the farm that we went to in Monee?
It's really all of the above. I mean, so we need to be thinking more strategically about whether it's the community gardens, whether it's the farmer. So it's what can all levels of government be doing to help people figure out how to feed themselves, their neighbors, supply local markets, and in turn supply global markets. I mean, the real fascinating part of the Economic Development Agency's role in this, there have been discussions that I've been privy to for years where traditional economic development doesn't talk to commercial farming. But at the same time, commercial farming doesn't talk to community-centered agriculture. So really, we need really all levels of discussion. There's a role for everybody to play.
And what was the agency that you're with?
Oh, I'm H&A Networks is an independent consulting firm. And we're in the process of working with the CED to raise some philanthropic funds to get this project going and really jumpstart a regional conversation about how people feed themselves.
And I'm assuming you've been in touch with the Farm Bureau as well?
Right, yeah. I haven't, not since our,
Yes, it's our hay
not
ride.
since the hayride
Yeah.
out on the Gorman Farm in September, but.
So what can we do?
I think for the moment, just like take a look at that article. I'm happy to, the article that I was shared, and just be the particulars. There was an $800,000 of ARPA money that the county approved for 4 nonprofits to develop some community food infrastructure. And if you look at this article, there's just a lot of challenges. So I think if, like, working in being more aware of how the MAP Collaborative, what do they need on a monthly basis? Just first for the moment, just be aware of this,
Yeah, I have,
Take-
I
yeah.
love attending the MAP, and I've tried to get, more people to go to it. It's I think they're doing great things, but I appreciate you. Thank you.
Good. All right.
So the way I understand it, one of the problems that we have is creating that market for this, because food is hard to sell when it's ripe, when it's the best,
Right.
right? So you need local markets. And then trying to generate funds to start people willing to do this is tough. And that's where the real problem lies, right? Because all the help goes to row crops, right? For ethanol and, other things, and, materials, not necessarily food. So I really appreciate this stuff. And I think, if there were some way to create grants from the federal government to, like, MAP and these other local outlets, these are small outlets where you could easily distribute this food to. Grocery stores require large amounts, and you got to continuously fill. And they're not looking for exactly the same. They're looking for stuff with a shelf life, which means it can't be at its best. So I like the idea of using, organizations like that, food pantries and stuff. And if we could get federal grants to help these farmers to have, money to grow this for them, I think that would be great. Everything's going to be market driven, right? So, maybe, maybe the tariffs and, China not buying soy, maybe farmers are going to be like, hey, we got to grow something else, if we want to make money. So this might work for us. I mean, it's tough. We have the richest soil in the world, right? And we don't grow food. That's, to me, it's just, I don't get it.
Yeah, there's going to be a need to diversify, but the people are locked into the commodity price supports. It's hard to move off that. But just even on a more basic level of what we can do now, if you take a look at the Riverwalk Food Pantry, the acquisitions manager, they have a brand new community kitchen coming on board. People, they're planning, nutrition education programs. They're planning to provide, a soup, make soups once a week and have an entrepreneurial opportunities. So the acquisitions person was unaware of the fact that who's like trying to build a network of food pantries. Cause to address this, how do we have better coordination and collaboration and bring forward local production, whether it's going to be given away for free or sold at some price. But he was unaware that another grantee from the county is over in Moni, has their own community kitchen as a result of this county fund. So in a way, if we could sort of empower those folks to just be figuring out how to collaborate more, that's a good starting point, and then let them sort of surface the needs and bring it forward to the policymakers.
Have we reached out to some, because I think there are 3 farms out here that do grow food, like Gorman, right? Yunker, is it Yunker? And there's another one in Chicago Heights. I know they sell food at our at the farmers market in Frankfurt, and I go there every time. And I asked them, I'm like, so where are you out of? Expecting them to say they're from Michigan. That's where all the fruit comes from. They're like, Chicago Heights. I'm like, really? I mean, that's not where their farm is. Their farm's in Will County, but they actually sell stuff right there in Chicago Heights too. So we have a few farms. If we could just reach out to them and try to find a way for them to succeed, what do they need, and then, who knows, maybe it catches on.
Yeah, no, that is what do you need from us kind of thing. But again, that's where we want to do this asset mapping to just begin to get a handle of who all's doing what. And so that's the starting point. So.
Do we have any other questions? Well, thank you very much.
Thank you.
This is
All
a
right.
subject I'm very interested in, and I want to support in any way I can.
All right. Thank you much. Thanks, everybody.
Thank you. I beg your pardon? Wait, hold.
Remember seeing it, but
Do you need a,
It was just published yesterday, so it'll be circulated. I gave it to share.
Thank you.
Sure.
Yeah, we'll get it distributed. In fact, Jackie just distributed it to me, so.
do we have any other new business? Nothing? Not that I know of, so I guess not. Informational reports. All right, so first we have, whoops, I am so sorry about that. From Kathleen Burke, she could not make it today, but she has filed a report, right? And if there are any questions, we do have Elizabeth who can take those questions and get back to us, right? Do we have any questions or not at this time? Okay, so we will move on. Maggie, would you like to give us your report? I'm sorry if I should say Maggie McDowell. Am not being formal enough? I tend to be very informal, so. Okay.
Everybody, Happy New Year. Is my, oh, there I am.
Yeah, you're
Okay.
good. We have someone on that now, so that is out of my control. So
I was
so I
gonna
have a
say-
professional that works on that.
Multitasking.
So our speakers and roll call should always be done on time now.
Okay, well, good morning, everybody. My report is brief and pretty straightforward. I did share details with regards to our major annual event, which is our Home for the Holidays. And I'm very happy to report that that was extremely well attended. All our families and everybody came out in droves to actually participate and be there for their loved ones. So everybody did have a wonderful, joyful event. There's lots of pictures that are posted on Facebook. And I do want to take this opportunity to actually acknowledge and thank all of our county departments that really came together this year. Whether that was, and I'm not going to name them individually, but so many of the departments really came together and collected items for our residents and dropped those off, did various collections. Various individuals offered to, to purchase gifts for our residents. And we had so many community friends that came together too, whether that was, the health department, brought cards in for the residents. So really, the residents had a wonderful holiday season. So I appreciate everybody thinking of the nursing home and thinking of our residents and participating and making the time a very joyful season for everybody. So thank you. I also am mentioning for January, we are celebrating our National Activity Professionals Week, which runs from January the 26th to the 30th. And our group of life engagement staff participate and are the first line of engaging, individuals with our residents. They plan all the activities, they plan all the musical events, and they keep our residents busy. And again, we look at this too. We want to engage the residents. We don't want them to be socially isolated. We want them to come out, engage and participate in the activities which they do. And it's thanks to this wonderful group of staff that we have. Also, just announcing that we do have our annual Illinois Department of Public Health and Life Safety Survey that's on the agenda. Our survey window opens up 3 months. We had our last survey January of 2025, and our window opens up traditionally 3 months before. They will not come out in January this year, but they will come out 3 months before. So the window opens in October 1, and then it closes April 30th. So 3 months before and 3 months after, but not the month of the prior survey. So this is an unannounced survey. So of course they can come in at any point. They don't tell us what day or when they're coming. So we have to be ever ready, which we are. And then there is the health survey component, but there is also the life safety component, which looks at the physical plant and, safety and security. So usually when this occurs, the surveyors, probably 5 or 6 surveyors from Illinois Department of Public Health, will spend between 3 and 4 days on site. So that has not occurred because obviously we're in January right now. So February, March, or April, is when we anticipate that occurring. Sunny Hill on an annual basis also reviews so many of the plans that we have, but one in particular is our emergency preparedness plan, and that annual review is currently underway. We preview the plan. There's multiple policies and procedures involved. There's a very extensive, robust communication plan, and then also there's a component for testing and training, which, as I segue into our Sunny Hill Governing Advisory Board meeting, which is actually scheduled for January the 20th at 10 a.m. at the Will County office in the boardroom. And I have actually extended invitations to certain county board members. If you can just let me know, some of you already have, who's actually going to be in attendance at that. All of these different plans and information with regards to survey and different events that have occurred over 2025 will be reviewed and discussed in more detail. And that actually concludes my overall report, unless anybody has any specific questions for me.
Of course I do, Dan. I'm curious, how much money was made during the holiday bazaar?
That's a good question because we haven't had our formal Friends of Sunny Hill follow-up meeting.
Okay.
During the winter months for November and December, we don't actually have a meeting. So when we resume our meetings, I believe in February, we'll actually get an accounting of that. I don't have it readily available.
Always get really excited.
Yeah, I'm curious too.
And Maggie, I have 2 other questions related to operations, I guess. Your report said that you have 142 beds full right now? Or is it 146? I looked at it.
156 beds capacity.
That's how many you have.
That's how many
but
we have.
you
And
have-
that census tends to fluctuate depending on, admissions and discharges. So
Right.
from day to day, that can actually change.
My question was if there's 156 beds and 140, let's say 142 are full, or even 146, that's 10 beds that are empty. But yet you say there's a waiting list, and I'm just confused as how can we have beds empty and a waiting list?
Right now, as of today, I believe our census is at 153.
Okay,
Okay, so
we
our
have to have a
capacity is
couple of them.
156. And again, depending on who's coming and who's going. So we could have had 6 discharges yesterday, but we're not going to get 6 people in right away because we have to process now those 6 beds are empty, whether those are planned discharges or those are unplanned discharges. So there's that change that occurs. So you're always going to have, because of that movement, you're going to have people coming and going. So if you have 6 people that either discharge home for or discharge for whatever reason or go, and we have those beds open, now we have to process, even though we have a waiting list, we have to process those people in order to say, okay, are you ready to come in, and get that set up. And that turnaround time can actually take a couple of days. It doesn't happen immediately.
okay. I figured that was going to be the answer, but I had to ask
Okay.
the length of time.
It's
to
the
go through all
logistics
the
of it, that in
paperwork
and out. Yeah.
And then my other question was, we did pass a thing to raise the rates. We're started in January.
It was starting in February 1.
Okay.
Yeah.
So I thought it started. in
Because I
January.
have to give a 30-day notice to families to make them aware of the increase. So that had the families, the POAs have been duly notified.
So since it's not in effect yet, I was just curious. I was going to ask, what's been the feedback on that? So-
Actually, I have had no, and I've actually checked with my finance department because in the letter that I sent out to families, I did say to please either reach out to me directly or reach out to our finance department. And I haven't had any, comments or feedback to date.
I was just curious. So thank you.
Yeah. Thank
So,
you.
I just had a question. So on the bed situation, do you ever have a bed in a double, like a room where 2 beds could go?
Correct.
So
And
that
we
could
do.
also affect the numbers, right?
Well, we can't change that because that's dictated by when we submit for our licensure to IDPH, whatever we dictate that bed, that room to have, that's all it can have. So when we adjusted years ago, historically, we had rooms that were double rooms. There was a time, and I don't know when this occurred exactly, but we went to private rooms. Now, we retained double rooms to an extent because obviously we've talked about this before in terms of maintaining that and having that availability if we have a family that have a husband and wife, they want to stay together. So we retained a certain number of double rooms, but primarily we have private rooms available. But we can't, just because the room has the capacity to hold 2 people, we can't just move somebody or put another bed in there. That's a whole IDPH licensure process because
that's right.
whatever it's licensed to be is what we
I
have to
just
have
thought
it.
that kind of affects the statistics of how many.
Yeah, whatever that room is designated to be. If it's designated a private room, then it has to stay a private room. If it's designated as a double room, then it's a double room unless we change our licensure.
Fair enough. Mr. Richmond?
So you kind of hit upon some of my thoughts, Dan, so what would it take for us to change more of the rooms to be double rooms? You said licensure.
That would have to be a licensure issue. There was a time, and like I said before I took my position, where the rooms were double rooms, and for many reasons, they were switched to private rooms because that was what the consumer was looking for. And I think personally, it would be a very retrograde step to actually go back to making those double rooms again, apart from the cost factor to create those as double rooms. Because now, the items that were supplied for double rooms, some of them are still there, some of them are not. They're not necessarily set up to be double rooms anymore because they converted to private. But I think it would be a very retrograde step just because if you go in the hospital, you don't want to share a room with somebody else. Likewise, for our residents, they don't want to share a room with anybody else. And frequently we have feedback from our admissions coordinator in terms of, we've had people decline to come because once they hear that they have to share a room with somebody potentially, they're not coming. Our consumers, our residents, don't want to have to share a room anymore. And I don't think necessarily, yes, you could increase your beds, but you may have more beds, but you won't necessarily have more beds that are full.
So what I'm hearing though out there is that there's a high demand for this service, the service that you provide. It's purely a licensing issue. I also hear the fact that sometimes you need to there's empty space because we don't have anybody to put in there. If we were to open up some of those rooms to double rooms with the people knowing that they have the ability to move into one of these rooms in a private setting at some time in the future, what you're doing is you're creating a queue so that this way people can move in and we can actually maximize our revenue, but at the same time too, provide a service that I'm hearing is very much needed out there. And we are a 5-star facility. So why aren't we trying to maximize that by setting up some of these rooms? Because what I'm hearing is licensure. That just means it's some paperwork. Admittedly, we might have to buy a few more beds or something like that. But just like anything else, you create a queue so that this way these people have the opportunity to at least be in this 5-star facility. But at the same token too, they do have a little bit of maybe discomfort of having to share a room with somebody, but they know that they're in line to get a private room in the very near future. Because what I saw is you've got, I think it was 18 people moved out or something like that in 1 month of the report or something like that. I can't memorize everything, but that to me would seem like a good way of keeping our facility full and providing a service that's much needed out there. Is that a possibility?
Anything is possible, but there would be the associated cost that would go with that, because if you increase your census, there are prerequisite requirements per IDPH regulation for staffing and for everything else that goes hand in hand with it.
So
Anything
you
is
do a business
possible
case.
at a cost.
Yeah.
I mean, that's the other aspect of it. And I do see that the biggest impediment that we would have would be, most of our competition, so to speak, other nursing homes have all converted to private rooms just because that is, and again, we moved in that direction years ago for that very reason. We have a very extensive waiting list for admission, but also waiting list for a private room. And that is a very contentious issue in terms of, people wanting their privacy and wanting a space for their items. Putting 2 people in a room, it creates an issue in terms of a spatial issue. We have residents that require Hoyer lifts, that require a lot of equipment. And when you have a lot of that equipment, it makes it very difficult to navigate around a tight space for staff and for residents themselves. So anything is possible. I just personally, having been in this field for 40 years, I don't think that this is the direction that we should go, even though we want to increase our beds without offering, if we wanted to build and we wanted to extend in that way and offer private rooms, yes, but not necessarily using our existing space, because I don't feel that our community, our residents are looking for that. Our families are looking for that. They're looking for, they're aged, they're fragile. They're looking for, a space of their own. It's a 10 by 10 room at best. Now you got to share it with somebody else. It's not ideal.
I'm just looking for us to be able to facilitate our services that are 5-star to more people from the Will County area. And I'm just looking at it from a perspective of how do we maximize that? That's all. So thanks for your time.
Okay, thank you so much.
So are you saying that a double room is a 10 by 10 room?
No, the double rooms are not. The private rooms are they're looking for, that's what they're looking for is a private room. The double rooms, I don't have the spatial measurements on them,
building
but they're
defines-
small. They're,
mean, the-
to put two people in there.
So the rooms are built and they're kind of defined already. So whatever
Correct.
rooms you can have some singles, some double.
Correct. And the building was old. We renovated. We didn't build from the ground up. So those rooms are what they are, in
does-
terms of the size.
Does having more residents help you to increase your profit loss, like to make sure that you make the money and you're
Well,
covering-
well, absolutely, if we have more residents, but if we're looking at delivery and quality of care, we have to look at all across the spectrum in terms of all aspects, in terms of staffing and everything else, because I want us to continue to be a 5-star facility. And, I want us to continue to be a viable entity in the community and to offer the wonderful services that we do, because there is a need. Our population is aging,
100%.
and, we have more people that's going to require the services.
100%, I agree with you on that. I wonder though, is there anything that you think that we could do to still provide that 5 stars, since we're referring to it as that 5-star service, but cover our costs better? Like, is there something else that we can do? Because honestly, I mean, and this is just me, I'm not trying to promote anything, I'm just telling you what's going on in this guy's mind. I would love for this to be a very successful model, because in my opinion, it needs to be much larger. It's almost too small, like 157 people. That's not that much people. I
We're
would like to
considered
see-
an average size. We're not considered a
No, but I know,
small
but I'm saying-
entity, but
But I'm not trying, I hope you, sometimes I have a way of being too direct and too blunt and not saying things the way I mean to. But what I'm saying is, I think the elderly need to be taken care of. And I think that it's an important service. So how do we provide that good service, but still cover our costs? Because it really needs to be bigger than it is. And if we can't prove it on a smaller scale, there's no possibility of it getting bigger, because there's way more elderly people that could use this than 157 people. So I guess I think that's part of Mr. Richmond's concern. I know it is my concern, and I would love to see this thing thrive. Okay, so.
And certainly, I acknowledge, we have to remain viable and we have to balance the books, so to speak. And we are looking at that very closely. Obviously, we do on a consistent basis. I know that, speaking with my finance director, I know they are making some adjustments to, because there's so many insurance companies out there that it's a quagmire most days, and that all tends to change. They're looking to get, residents on managed care quicker, which yields a higher return. So there are different approaches that we are initiating in order to kind of balance this a little bit better. The other area that we're really focusing on with the nursing department in particular is the agency and the overtime budget, because obviously we have a lot of staff. Like many of the other entities within the county, we're 24/7 operation. So that tends to, be very high. So those are areas that obviously we are exploring, so that we can obviously balance this better than in the past.
Well, in the future, if you can bring any of those ideas up in more detail.
I can have
and-
my
and-
finance director come in and review
talk
that.
about those things in that way, to get the support, from the whole board.
Mhm. Yeah, I will have Shelley Falcons, whenever this this committee would like her to come, she'd be more than happy to share her ideas and our approaches.
Yeah, that would be awesome. That sounds great.
Okay, anybody have any other questions?
Thank you very much. I appreciate it.
Okay, all right, thanks, everybody.
Okay. And we have our closer coming up, Elizabeth Valletta from the Health Department.
Happy holidays to everyone. Here. So I have several reports in here, but I'm just going to hit a couple of highlights. So hopefully you had a chance to read
We
them.
have some time today, so.
Okay, so one of the things, Caitlin is here. She is our map coordinator. So we have a new map website and we have issued our new iPlan. So hopefully you've had a chance to take a look at that or go on the map website. So we're very excited about that. They're going to start going around the county and bringing our map initiatives to other entities throughout the county. So that's exciting for us. I also have here Sean from Environmental Health because I wanted to highlight that in October, they had a record-setting month where they ran more samples than they've ever run for fecal coliform, suspended solids, chlorine, and total samples in total. So I wanted to congratulate them on that. Let's see, there's so many things I wanted to mention. If you get into the January report, you probably read that we have had our elevator at our main campus out for about 2 months. Facilities has been actively working on it, so we appreciate that. And we're hopeful that in the future it will be up very soon to be working. We've had to work around with staff and with customers and clients, but we've been able to do that with providing access to first floor offices and first floor counseling to address the staff and the clients. I also have here, and I don't know if we've introduced you to our new health equity manager, Ashwarya, but she is also here. And there's a lot in my 2 reports about the outreach that we've been doing. So we've been conversing with our legislators, trying to get out there. We are part of NIPIC, which is Northern Illinois Public Health Consortium. It's a group of all the health departments in Northern Illinois. And we are looking for public health advocates, not only in the Senate, but in the House of Representatives. So we have been really doing a lot of outreach to our local legislators. We've had the roundtable is coming up with them. We've also had their communities days that we've done with them. And once again, as I mentioned, we're going to do an iPlan tour trying to reach out to them. I wanted to point out that not only did MAP, we have a lot of collaboration at the health department. So we had the MAP team, we had health equity, and we also had WIC from Family Health Services apply to NACCHO to get a small partnership in this initiative for breastfeeding. And we were awarded that and accepted into the initiative. So that's also mentioned into my report. Let's see. I also wanted to point out that we had a coat drive over the winter, and we were looking to gather about 500 coats, and we were able to collect 710 coats, in addition to bins filled with hats and gloves and scarves and snow pants. And so we were able to help over 170 families, and then we actually were able to donate some of that to local school districts to provide to their kids and families. So we were very happy about that. Also, in regard to MAP, all of the initiatives have started meeting again for the new year. So if you're interested in getting involved with any of the MAP initiatives, we have food, nutrition, we have maternal health and child health, and we have behavioral health and substance use. And all of the dates for their meetings are listed in my report. And Caitlin is here, so if you're interested, please just flag her down and join one of our meetings. We also mentioned about the recall for the baby infant food. And so that recall is still ongoing. It's by Heart infant formula. And at this point, it's in 19 states, 51 illnesses, 51 hospitalizations. So it is an ongoing recall of that product. You've probably also seen all over the news that illnesses are rising. So flu is on the rise. We just got a notice from Illinois Department of Public Health that it has, influenza has climbed to the very high level. So they are recommending that, of course, people, wear your mask if you're in a crowded area, or if you have any illnesses and you want to protect yourself or others, cover your cough, wash your hands, do all those things that we used to do. When you were a kid, they always told you to wash your hands and sing the ABCs. So make sure you wash your hands and cover your cough. They also mentioned that influenza-like illnesses are on the rise, and it's the highest in the past 6 years. New York right now is the highest for the flu. And they also mentioned that norovirus is on the rise. I don't know if you've come across anyone that has had this. It's not good. My daughter just had it. Thank goodness she's actually in New York and not here. But it's the stomach bug. And so she had it for three days where it is just increasing at a very high rate and it's very contagious. So please watch out for that. But public health is a lot going on, not only the increase in illnesses, but also there has been change in the childhood vaccination schedule that we're still working through as an agency. Other than that, I think that's my update. I don't know if there's any questions.
I do have some questions.
Okay.
Micah doesn't. Are you gonna wait for a second?
I do, but go ahead.
She's still writing.
Okay.
No,
Okay.
I've only got one.
Oh, go
It's-
ahead.
When is the legislative roundtable?
Ashwari, do you have the date? Is it the 14th or the 21st or? Oh, January 26th. I was completely wrong.
That is a busy day. I think everybody's liking that day. At what time?
I am not attending. Ashwari is attending for me. She'll look that up right now. I think we have something else going on that day that I cannot attend.
There's a lot going on that day. If I could get that information, I might like to pop in if
Excellent.
possible. Like I said, seems like a very busy and,
1 o'clock? 1 PM.
okay. And is it at the health department?
No, it is not.
Representative Avalars?
Ashwari, would you like to come up? Oh, okay. I'm
Thank
not
you.
sure if you've met Ashwari, our new health equity manager. So,
That's it.
Did you want her to come on?
oh, no, if the question is over, so.
Okay. Okay, so, some unrelated questions here, like
Okay.
through everything you talked about. I know, I just get confused on this with all the samples we take. Why do we not have an ability to test, for our soil? Like in there, is it, I know, is it so far out of the health department? I know you test the water, so not, but I know because we consume it, but still.
Yeah, we've historically been a water lab. The equipment that we have is exclusively for water and our lab analysts. And we are certified by EPA and IDPH for water.
I know you guys do a great job with water.
To branch out into soil and for metals, or what are you looking for?
Whatever. Yeah.
Yeah. I think the equipment costs and would probably be the reason we have not gone that route.
Yeah,
Sean Connors, Director of Environmental Health.
without having enough time to really research it, it would definitely be a cost issue for the equipment. And then, of course, the training of the lab analysts to make sure that they're accredited to do that type of testing. Probably have to add a couple of staff and maybe potentially renovate the lab to make it bigger. To accommodate that additional testing, but it's something we could always I could talk to Trish, our lab director, and ask her, give me a mock-up if that, but we'd also want to be a little more precise on what we're going to test for and who's going to need the testing. So it's great. I think I know where you're going. It's just, hey, I want to see what's in my soil. Is it got lead or mercury or something else, or due to various projects and industry in the area? It just, it just need to do a little bit more of a study on it.
So maybe we could somehow collaborate with our local EPA representative on that?
Absolutely, yeah, and we could talk to them. They're,
I researched this and you almost have to go to a different state. There's a few colleges, agricultural colleges, that might test.
it's really challenging. I agree with you.
Yeah, I feel like we spent a lot of money on different things. This seems like a pretty worthy expenditure. So if you don't mind, investigating that a little bit, I would love to hear what you come up
Yeah.
with on
I'll
that.
try to work with Tricia, our Director of Lab Operations, and we'll try to put something together, very high level about what it would need. I might want to talk to you on the side if it's okay if you want to kind of narrow what we want to test for, or
Well,
just,
like blights, right? Because they, I talked to some of the nurseries and stuff like that, and they say, oh yeah, there's a blight. It's going through here. Like, how do we know? Can't we test for that? Aren't we worried about it? What about, like, we had those, I think 3-4 nationals that were arrested in Illinois that, actually had like a contaminant, like some sort of, I thought it was.
I remember the story, but I don't remember what the
It
agent
was gonna attack the agricultural markets and stuff like
It's about
that.
a
So,
year ago
so
with
why aren't we prepared for something like that? That's I know it comes out, to me, it was super alarming. A fungus that was going to attack our agricultural market, but they caught them.
Yeah.
Okay, But what happens when something like that happens, you know, and all of a sudden stuff starts dying? We have no way of testing for
Yeah,
that.
well, we do rely on our partners, whether it be EPA or IDPH or private industry, and it would be hard for us to probably be competitive. When I was in environmental consulting, we would use obviously the local labs that were, you know, giving us whatever best price we could get when we'd go out to do our phase 1 and phase 2 sampling. And so I think it might be a little bit hard for us to be competitive, but we can definitely look into what it would take for us to do some type of soil analysis, but we would definitely need to know what would be the focus
Or-
of the samples.
Or collaborate with the EPA. Shouldn't they be doing that?
Correct.
Oh,
Shouldn't that be something that we should have access to? But I called our representative. I never get a call back, so.
And it's the same thing with food samples. When we go out on a foodborne illness and we have to collect samples, they all go to the state lab. So we might be the boots on the ground collecting the samples, but we're not analyzing them. We're sending them to the state lab. So it's very similar when we collaborate with the EPA. We've done water sampling for them when, you know, so we do have that collaboration and we can find out what services they have for soils too.
And I even talked about the forest preserves on property that we own, you know, like out in the woods. Wouldn't it be good to do samples to find out what's going on in the soil? You know, but they, you know, there's nothing. So.
I think where you're going is we'd like to have a bigger pool of labs to work with and who are accredited or not. I mean, you gotta make sure you pick the right lab too, because if they're not accredited to do
Now,
that.
that's what I'm
then-
gonna depend on you for.
Well,
Make sure you find the
I'm-
right
well,
one.
yeah, it shouldn't be a hard
Yeah.
exercise to, you know, they
No.
produce who their accreditation is through and what they're rated to test for. But yeah, as Elizabeth said, you know, we do have partnerships with IEPA and IDPH, and even with the food, when we go to the lab, the state lab for some food samples with a suspected foodborne illness, we have to be specific for which one, because the one in Chicago tests for norovirus all across the board, where the one in Springfield might not. Actually, I think I reversed that. Springfield does the norovirus and Chicago doesn't. So there's just some specialities. And again, it's just, we got to figure out how much it would cost.
Well, at least you got a network when it comes to
Absolutely.
that. So
Yeah.
that's all I'm saying. That's, you know, we don't have to assume all the costs. Let's build a network. Let's find an avenue to get these things done.
Sure.
So thank you for that. Another question I have, so you talked about the vaccine schedule. So is that, I just want to make sure this is correct. We're going from, you know, I've read that they're going from 79 to 11. Is that what we're at?
So
Because children now get like all the way through school, they get up to 79 vaccines.
that's doses.
Oh,
It was
79
17
doses, but still,
vaccines.
still.
It was 17 vaccines going down to 11.
Yeah.
And they're still available as it's a parent, you know, can choose to choose the other vaccines too with partnership with their pediatrician. And according to what I've been reading, and I've been trying to catch up on all of this that just came out yesterday, is that insurances and Medicaid and Vaccines for Children programs and private insurance will still cover all of them. So whether they are a consensus or a non-consensus immunization or
So
vaccination.
you just said not 79 vaccines. We talked doses. We're talking about 17 vaccines.
Correct.
So out of the 17 vaccines, will there only be one dose? Or will there be, out of some of those, will there be more?
I believe out of the 11 vaccines that are on consensus, I believe the doses is around in the 30 range. I apologize, I don't have
They
that
get
on the tip
30
of my,
They're gonna give 30 doses of the 11 vaccines?
I believe that's the total doses they would get across the 11 vaccines, but don't I don't have that here.
Next month, we'll get that number.
Yeah, no, it's in here, and I think it was in the 30s, because it went from, like I said, 11 vaccines to, from 17 vaccines to 11 vaccines, but it's different vaccines have different doses, and I don't have the number of doses in front of me. Sorry about that.
Okay, because, you know, of course, with the vaccines and everything, I always get confused, like, do they have to, why do they have to take all these vaccines? Does it stay with them for the rest of their life? Are they only subject to these illnesses when they're kids, and then when they get to be adults, they're not? Or,
There is some waning on certain vaccines. And then, I am not a doctor and I don't claim to be, but there is waning on certain vaccines. So according to the federal government and CDC, they have determined through their tests which ones wane quicker than others and what need boosters or what vaccines you need in 3 different doses or 2 different doses. That is above, you know, that's done at the federal level.
I guess what I'm
and CDC.
saying, I get confused at, I know like our kids are getting 79 vaccines, 79 shots,
Doses, yes.
Those,
but I only got 5. How come I'm not, like, how come I don't need all those other ones? Like, you know, as an adult, like, how come I'm not like, you know, like they're saying, you gotta get all, you gotta catch up, you know, like, that just confuses me. Why don't we need them if they're so,
Of course, there is some natural immunity that you obtain as you become an adult and as you have, gotten different illnesses throughout your years. And of course, the children have not been exposed to those things. So they have no natural immunity. So I would think that is part of it. Also, as we develop more and more, as world is changing and more things are being introduced because of travel and things like that, they've obviously been able to come up with different vaccines and they've seen the increase, like whether it's measles or it's mumps or whatever, has changed over time. And the need for it has changed over time. So once again, I am not a doctor.
that's
And
fine.
I would say that the CDC and the FDA have studied these, and that's why this new schedule has come out. It's called an evidence-based science evidence. We're cautiously looking at this, hoping that this will instill some more trust in public health and in the vaccination system. And that's what they were saying, is that trust was depleted. And so people were not getting vaccinated. And so then there were outbreaks because they weren't getting vaccinated. So hopefully people will have more trust in the vaccination system, more trust in public health, and we'll get the vaccines and then we will avoid the outbreaks.
So I don't want to, be going on about it, but I do have some other stuff that I would like to say, but I'm not gonna,
Okay.
because, but one other question about the flu and all that stuff. How come we don't ever talk about like supplements and boosting our immune system? I'd like to see like reports like that added to the mask.
So in
that-
Family Health Services, not to
Yeah.
interrupt, nutrition is one of the main focuses of Family Health Services in BBO and in WIC and at the Community Health Center when they meet with clients. It's all about nutrition, teaching them. We just had, actually, I think it was.
Because food is medicine.
Exactly, as Caitlin would say. We just had a trunk or treat at the health department, and part of it was teaching kids about what should be on your plate based on the FDA code, like how much vegetables and how much protein. So education on nutrition is huge for the health department. We're all about prevention. If we can prevent them, and we talk about exercise and we talk about nutrition. So yes, that is a part of the health department, of course.
And I know like when we talk about food, and it goes back to the soils, it all comes together because of the way we, grow stuff that, food doesn't have the same amount of nutrients that it used to have, and people aren't getting the same amount of benefits from that food. So there have to be supplements added, to really help the immune system grow. I just would like, when we give our reports, maybe to
Focus more on the
just
nutrition aspect, no
add some of the
problem.
nutrition part onto the end of that report, because we focus on masks, we focus on, washing hands is good. But, the best thing is our own immune system. And I think people need to be reminded of that and taught how to, strengthen that.
Of course.
Just terminology wise, when you say supplements, do you mean like pill
Vitamins,
supplements
like
or?
vitamins.
Okay, I would just point out that the supplement industry is one of the least regulated industries in the food world. It's not even considered food. So I think we would like to pressure maybe some of our federal politicians and whomever to have more research and regulation in that area, because that is kind of scary because you don't really know what's in those. And so I think that we would be aligned in is the term is healthy eating. So more of no antibiotics in your poultry, or how you're growing your food in your soil and this fertilizer you're using. I think that we'd be better served if we kind of took that kind of approach.
Yeah, I take a lot of supplements and I pay extra money because I know that there's a lot of supplements that aren't any good, and you
Yes, I
have to
know.
pay for good ones.
Yeah. But who tells you that they're good?
Yeah, well, that's true, but I trust
Yeah.
my guy at
Yeah,
my
yeah.
nutrition store.
There you
I've
go.
known him for a while,
And
and
you're still
he's
here.
he's a, an old martial artist guy, and he's been around for a long time, so. So anyway, all right, well, didn't mean to, sound like I was grilling people. It's just things I'm very passionate about and concerned about.
And I did, it is with 11 different vaccines, you're right around the 30 doses. And with the 17 vaccines, it was around 71 injections or doses.
Hey, do we have any other questions, Martha?
I have-
Anybody else? Thank you so much.
Thank you.
All right, and with that, I just wanted to say that I do feel a need for executive session. And
On what grounds?
on that I have questions for you, that I don't want to say the wrong thing out in public, so I feel,
You have to announce the grounds for the executive session. If you like, you want to step out for a second?
yeah.
You want to call?
I'm sorry, leave you hanging. I was
Proceed
just
to
gonna,
motion
yeah,
for-
Mike, I could take over and just bring.
I-
Yeah,
I
we're
think
gonna
we should
call
take
for
a 5-minute recess motion.
yeah, and it may, I was gonna say.
Second.
Okay.
Thank you.
Thanks.
So Perla, that was a motion by Williams and a second by Costa to take a 5-minute recess.
All right. I guess we are not going into executive session on the advice of our state's attorney. We're working something else out, but, okay, do we have any announcements, from the chairs or from the, members? And I have,
Actually, I do. I don't know the date, but I do know that coming up, if any of the board members want to sign up or go help, the county executive's office is doing another, fresh food delivery in Crete. I don't remember the date on that, though. I just saw it this morning and thought we should let everybody know that. So that's it.
yeah, I think I brought some food over there. Okay. I guess I went a little bit out of order there. Can I get a motion to adjourn?
Second Freeman.
All in favor? Aye.
Aye.
Us.
And the day we have all the time in the world.
All right, next meeting is February 5th.